it's the time.
May I have a go?
Yes, of course.
I think I have asked before as well, but I keep finding these, well, SCM, releasing SCM is my enemy anyway.
Oh.
And then I see people who's got a problem with the immune, like say, they had the post-viral syndrome and then they developed ME or fibromyalgia and that type of people. And they have got an issue with the, generally with the sleep, and generally, high in stress situation and a lot of, tight neck. And then on the right hand side of, C3 area, but then they tend to just go on the left hand side as well. I mean, it's a small area on the right and the left of the cervical spine anyway, isn't it? But it's really tight. And I've to release it, I've used obviously Sanjiao A, Sanjiao 5, and together or along with GB4041. And just because it's a close proximity with SCM and the immune, I usually tend to use immune as well. And obviously from the history, but just those tenderness with the cervical spine area, it just tends to linger, or I can remove it, but then it's always come back as, some other people, okay, release it a couple of times, it just changes, or, it gets better, but it just seems to be not being effectively treating and removing.
Okay. Now you said that you started saying that these are people who've had some sort of viral issues or some immune issues that led to what's ME?
I
think it's something
fatigue.
England uses.
Yeah. Oh, is
the
it
chronic
English
fatigue
thing?
type?
Yeah, chronic fatigue.
It's not the expression we use in America that I know of. Okay. So a few. Let me get around it in a few ways. First of all, you started, you're asking about the SCM, but you said I'm asking about the SCM, but you're actually asking about C3, it sounds like.
Yes, but then for some reason, it just seems to be always just comes in when I'm having a difficulty removing a C3 area, or, just on the right and left, they seem to be having a tight SCM that I can't release as well. So does it, yeah.
Yeah, they are really, okay. So, yeah, so so you have a number of ways to release the SCM, first of all.
Yeah.
So talk about the SCM. So, forget the gallbladder. The gallbladder points are sort of extra.
Yeah.
Okay, it's a support to some extent, but your big points are either Sanjiao 8 or Sanjiao 5, opposite side for the SCM. Your next possibility is kidney points.
Yeah.
And your next possibility is stomach chi. Those are the three kind of big options on, for quote unquote releasing the SCM, as if we're talking SCM only. Now, if they're showing very much at the top of the SCM and you were showing kind of on the back, so it's above the immune, but almost like under the mastoid, you have two choices for that. One of them is Sanjiao 3, same side, and one of them is liver 13th, same side. Okay. Now, the C3 part is, because you also talked about these people are stressed, etc. The C3 can be a reflection of the diaphragm being the other end. C3 and the diaphragm are both the two ends of the phrenic nerve. Okay, so what happens is that if the diaphragm is tight, there's gonna be a reflection to some extent at C3 and the other way around. If you have a congestion around C3, it's gonna reflect on the diaphragm. So you have a number of ways to approach it. Supposedly, on the right, liver 1 can release C3. And this is actually more, in my opinion, more accurate. Then the left side, which is supposed to be spleen 1, might release C3 on the left side. I tend to not have that much luck with spleen 1 on the left side. So that's one way to look at it. The other thing is, you can release the diaphragm, for example, with bladder 2, and bladder 2 also connects to the occiput. Okay. So you're kind of getting two options there together with bladder 2. That could be the thing that will work for it. I would also, again, kidney is going to be worthwhile checking, as well as inner yin will be worthwhile checking. And the other one is liver 8 is a possibility. Okay. So those are, now the other option is not so much C3, maybe a little lower. I mean, it's all like, well, who knows what these numbers are exactly, kind of thing. But often these people will show in stomach 9. And that can be, stomach 9 is considered, the reflex of primitive things. Okay, the primitive reflex. So it has to do with, things like, like when you check it, obviously, is like last week we talked about anorexia, bulimia, what, like needing to eat or vomiting, but also breathing is also a primitive reflex. Okay, and so it's possible, yes, you use stomach 9 to release the cervicals like C4, C5 more than say C3, but also there can be an effect. So sometimes maybe releasing stomach 9 first will be helpful, and then releasing the cervicals. And if you're looking at releasing the cervicals, sometimes you need to release the scalenes, which is the blood supply to the cervicals. And so using lung 8 or spleen 3 or even heart 3. So those are the things that I would suggest, besides looking at the history and treating the patient, so to speak, that talk about, in terms of just addressing the C3 component, would be possibly the liver 1, spleen 1 possibilities, kidney points, liver 8, inner yin. If they show on the scalenes, spleen 3, lung 8, or heart 3, or all 3 of them. And the last one is, and also checks stomach 9. Last resort, after you've released everything, blah, 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 try needling stomach 9. Oh, and bladder 2 was another option.
Stomach 9 in what direction?
Okay, so you go in front of the SCM. I needled in and then slightly down. So into the SCM and downwards towards the clavicle slightly. So it's going back towards the back of the neck and down towards the clavicle. You do what would you definitely, well, first of all, just for clarity, I use those dark green needles, the 0.12. So there's not much of a chance I'm hitting anything, but just, because, the needle will give way to the artery. The needle's not going to push the artery. But just in case, if you use a bigger needle, then it's a problem. But I do not needle it. First of all, you do want it slightly, almost backwards, almost slightly laterally. Definitely, you don't want it towards the middle line, because then you're kind of pushing your way into the artery. So you definitely don't want to do that. So I'm going back and slightly down, and not a huge amount of the needle. I mean, that's a place I use a 1/2-inch needle and the super, super thin ones. I've never used the dark blue, which I believe is even thinner. But I do use the dark green. I don't use the light green ones. The dark, so it's the, I'm not sure what the numbers are there.
Thank you.
Camille, you were going to say something?
Yeah, I have several questions. So first of all, which liver 1?
Oh, you're going to have to find out which liver 1 works the best. In the center of the toe, on as the Jingwell, on the Jingwell, but on the crease, halfway between the crease and any of them.
Got it.
you've got 5 options.
Yeah. Okay, got it.
I generally go for I generally start assuming it's normal, that liver 1 is like as if it was a normal Jingwell. That's the one I start. I then move to halfway between normal Jingwell to the crease. Then I move halfway between the nail to the crease in the center of the toe. And then I go on the crease, both in the center and on the side of the nail. But my order generally is the standard that's as if it was a standard Jingwell, then as if it's as described by the text, halfway between the crease and regular Jingwell. And I believe that's what the text says. And by the way, there's one more, treated as if it was pericardium 9, meaning at the tip of the big toe. But that's extremely rare. That works. That's for people with eye problems. That point is for eye problems.
Okay.
So if they have eye problems and they have a neck problem, blah 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 blah, then fine. But otherwise, that would be a liver 1 that I would ignore.
Okay. And I have 2 other questions, and they're very big. So if anyone has more about this, small questions, but one would be, can you talk more about this stomach 9 reflex of primitive things? And then my other question would be, and you can take them in either order, is can you distinguish this C3 treatment from basilar artery treatment?
Yeah. Okay. Fair enough. I'll take them in the order you put them. So stomach 9 is a place, well, there's many different ways to look at this so-called primitive reflex phenomenon. Okay. One thing is it's on the carotid artery, and so therefore it is going to control the oxygenation and circulation, not bloodification, circulation of the brain. Okay, because so it has a strong capacity of informing the body or the brain of what's going on. Okay, it's also, just, quote unquote, philosophically speaking, it is a central point in the neck. Okay, now you can say there's lots of others, granted, fair enough. There's stomach 9, and there's stomach 10, and there's large intestine 18 and large intestine 17. I mean, there's a very large congestion of points in this area. Okay, and quite honestly, I'm talking about in front of the SCM at this point, but also slightly behind it and in between the 2 heads are also things that work. Okay, the needling technique doesn't have to, once you're going in between the 2 SCMs, you don't have to be as careful as moving the needle backwards. Okay, but so this is an area that it's almost like a gauge, like when you have plumbers or whatever, they come with these little things that they put on the tap, and they can tell how much water flows or something. Stomach 9 is one of those areas, and by name, it's called Wen Ying, the welcoming humanity, welcoming being a person, welcoming humanity, something like that. So, so it's the ability, so you can say also the neck itself, primitive organisms don't have necks, for example, fish, reptiles, the eyes, the mouth, whatever. I don't know if they have ears, but because I think they're on their sides, but they have some sort of sonic things or whatever. But what we associate with a head as a separate organ, the mouth, the nose, the ears, the mouth, the nose, the eyes, are kind of all as if part of the body in the more so-called primitive versions of evolution. So the neck is what gives, the neck takes you away from just, quote unquote primitive and gives you a much larger brain. And I know the whales are going to be very upset at what I just said. It's not fair. It doesn't always work that way. And I'm not necessarily even trying to argue that humans necessarily have bigger brains than anything, but it would appear that we're very brain oriented. Okay, and emotion oriented, and it all gets processed in the brain, and it's not as integrated within our body as it is for other species. So this is something that on the one hand, I'm saying it reflects primitive, but it also, this is the area that separates the primitive from just being, if you want to be very Taoist about it, but being natural, to have just a natural outlet, that it's all like one thing. You know, I got a stimulus, and as one organism, I just naturally respond. By the time we've developed a neck, there's going to be a certain amount of separation from sensing something. Now it goes to the brain, it figures itself out. Now I may also have a frontal cortex issues, and it will get mixed with all my perceptions and whatever, and then I'm going to transmit a signal back to the body to react. So, you know, so stomach 9 is that junction, is that bundle, I don't know, of that controls all, you know, that, I don't know, it controls all that traffic, but it has something to do with all that traffic, you know. So, and that's why it has to do with primitive reflex. In terms of resolving it, I would look, as a primitive reflex, I would look primarily at the stomach chi points, the bumps along the stomach channel, and possibly at lung points, either lung 8 or possibly lung 4. Which, by the way, Chiho, for because of the tight diaphragm, lung 4 allows for more oxygenation, for more opening of the chest. So lung 4 might actually be a good point for these people, you know, and may actually release the C3. No guarantees there, but it's just a speculation. So that's, I don't know if that was too small an answer for the big question of stomach 9's primitive reflex.
The answer is the answer.
Well, yeah, no, sometimes you have other, you know, you very, very Taoist, no neck involved. No, but you know, sometimes we have other things that I'm looking at, and you know, so the question may not have specified. And insofar as C3 versus basilar artery treatment, which is quote unquote the whole cervical, so could be more. It involves that, or it can involve that, which is why I offered liver 8 as part of it, because liver 8 is, so basilar artery is, originally it was kidney 10, liver 8, and Sanjiao 8 to release the cervicals, and you needling same side. I actually tend to use either kidney 7 or kidney 9, possibly. I do use liver 8, although sometimes I'll substitute it with either liver 9 or inner yin. And I use Sanjiao 8 as is. And on the back, the treatment is supposed to be Ihikon, which is bladder 60, bladder 40, which is really, but you want that bladder 40 more lateral, so it's really more like bladder 39 or even above the crease, more like bladder 38. And the main point, and the point that you're actually checking, you know, because you can't check all three, right, at the same time, is bladder 58. Okay, that's the point that I'm going to press on to see if it releases the neck. That variation, by the way, I will sometimes change to things like bladder 58 will always stay. That's the main point. Okay, but sometimes I will use gallbladder 39 needled upwards instead of bladder 60 needled upwards. And sometimes instead of the bladder 40, I will actually use bladder 35 at the ischium. Sorry, 36 at the ischium. So there's different substitutes that I might entertain with Ihikon, but 58 will stay. So that, but C3 can be affected by basilar artery. Now, basilar artery also includes possibly under the occiput. So it's not just cervicals, but it's also under the occiput. Both things can be there for, you know, as an indication for that treatment. C3 specifically can be part of basilar artery and can be affected by it, but it may also be other issues, specifically the phrenic nerve and specifically congestion at stomach 9. So that's why there's a slight difference. And then also typically the C3 area, if it's on the right only, I start getting suspicious about the state of their liver. And if it's left side only, and that's a little, again, a little less reliable, I start looking at the state of the heart. Is there cardiac conditions in their family? Because that can be part of a cardiac pattern, C3 on the left. Okay. So does that answer the differentiation between C3 and basilar artery?
Yes, thank you.
You're welcome. Anyone else?
I might ask about a particular case, Abby.
Sure.
It's in relation to ears, I think, mainly. And actually, it might be just as handy for me, because I have it in front of me here, just to read out the patient's description themselves of the symptoms and that. So this person was told by a GP that they probably had water in the eustachian tube. So it appears that there was a nasal decongestant spray prescribed, which didn't work. And yeah, okay. So the main symptoms are a bubbling. She describes it as a bubbling sensation in the ears, which she has most of the time, at varying degrees, and she describes it as one sort of pop crackle per swallow to a number of these in succession. Sort of feels and sounds like a bowl of Rice Krispies in my inner ear, but with more forceful snap, crackle, and pop. One ear is normally worse than the other, but it can alternate between the ears. And yeah, she just says popping the ears by holding the nose, blowing the air doesn't solve anything for her. Now it gets bad, in particular it gets bad after being in water, like swimming or washing her hair in the shower, and is also exacerbated by alcohol for some reason. It's usually worse at night lying down. And this person would be kind of prone to ear kind of infections as a child as well, and prone to ear pain in general. So another ENT specialist actually told her her ears were perfect, and that she didn't have a fluid in the eustachian tube. But she herself is convinced that she does have problems draining fluid, because that specialist, she says, saw her when her problem wasn't really too bad at the time. And then there was also mention by this specialist, I think, that it might be a TMJ issue, but she's not sure about that. And she did grind her teeth, and grinds her teeth a lot. So I think she was asked if the dentist had ever mentioned about this TMJ issue. So that's kind of basically it. I was just wondering what you might look at.
Cut off the ears, no. So, all right. All right, so I would say a few things on that. The fact that she's had, I often approach ears with the idea that they're susceptible to ear infections. I start there because so many people, as children, that's in people's backgrounds, often without them knowing so. Okay, so, or without, because they don't know that they had ear infections, the parents know that they had ear infections. So I would start with a possibility. So, I check, Smoy test and gallbladder, well, whatever order they come in. Sanjiao, gallbladder, Smoy test and gallbladder, I think it is. Sanjiao's the top, Smoy test, I check this, I check, I think it's Sanjiao 17 back in the back of, I check the area, and I also check the mastoid is often very related to the ear. Also, in connection to the discussion before, C3 is also can reflect the ear. Okay, so you want to look at C3 and resolve it, possibly needle it at the end. That's an option if you really want it. So I would start with, I have my reflexes, and now I'm going to start with, and then I have other reflexes that are unrelated to the ear, say in the abdomen, in the neck, wherever. And then I will start with checking out Sanjiao 8 with spleen 7. That will be my first sort of go-to. And then the next one is liver 13, especially if they're showing anything around the mastoid. Now, at the end, again, if you're choosing to do C3, which is totally up to you, you can also needle into the, if there's any puffiness kind of attached under the mastoid, you can needle it. It's best to do it when they're lying on their side and needle it that way, because it's kind of hard to needle it in any other positions. It's possible, but it's kind of nicer if they're on their side. So that's kind of like the targets. Then other points that work for ears are heart 3. Sometimes works for ears. It's not a panacea, but it's worth checking out. And then because, listen, if she's grinding her teeth, if there's evidence there she's grinding her teeth, she basically has TMJ. I mean, it's kind of like, it's very unlikely that, everything is loose and the teeth are just going bing, 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 bing and grinding each other. There's some pressure going on there, okay? In all likelihood. So I would say treat TMJ. So now we're back to Sanjiao 8 already, to release the TMJ. Then we can use kidney. Kidney 9 often is a good point for TMJ, but it could be kidney 7. And usually at that point, I do it as an adrenal. And then the other thing that can work is behind gallbladder, just behind gallbladder 21 often releases the jaw. And the center of the chin can release the jaw. So you have a bunch of different things to release the jaw in order to release the ear. And then, so I would say looking at, if somebody, the moment someone has TMJ, that becomes, I don't want to like overemphasize, it becomes the priority, but it's pretty much a priority. Okay, is it like diabetes? Maybe not. Okay, but it's, so in relationship with the stomach 9, so your TMJ is on basically stomach 5 is affected. Okay, stomach 5 is the point where it happens to be called the great welcome. Okay, so this is the person's welcome and this is the great welcome. The stomach channel goes from the eye through the mouth and goes up to 224. The second branch, the one that we mostly talk about, the one that goes down the abdomen, okay, starts at stomach 5 and goes down to stomach 9 to stomach 12, et cetera, et cetera. So stomach 5, even though nobody ever thinks about it, is actually a really major point in a weird way. So freeing that frees the neck, it frees a lot of other things. Someone who has tight jaws is likely to have a tight nervous system. It's hard to have a relaxed nervous system or you're holding your mouth the whole time. I'm exaggerating. I mean, nobody walks around like that. Well, maybe some, but it just makes it a little harder to release the nervous system. So releasing the jaw, if they have jaw issues, it's important to address them. And then, yes, is the jaw issue sometimes just purely muscular, and could spleen 3 work on something like that? Maybe. But generally, the TMJ, stuff that I do will be Sanjiao 8, either kidney 7 or kidney 9 with kidney 27 usually, and behind gallbladder 21 and the center of the chin. These are like the standard go-to that I have for the jaw. And for the ear, my standard go-to will generally be Sanjiao 8 with spleen 7. With supporting that, I will look at liver 13. I would look at heart 3.
Okay.
And then at the end, I might go locally onto the mastoid and even possibly to C3. Now, there are some points around the ear, like if you take the back of the ear and just go up, and you'll find again, that's supposed to be a good point for tinnitus as well as glaucoma. So you may find points around the ear in the parietal lobe that could be helpful. Yeah. And that you'll evaluate whether maybe it releases reflexes, or maybe when you press on them, she says, oh, the bubbling is cooler, small, less, I don't know, whatever is better for the bubbling noise.
Yeah. And would you use the thyroid, the point in the back?
Yes. Okay. So the reason I didn't mention that is because if I use that, I'm going to be very tempted to use 2 points in the front also out of the Sanjiao Smoitas and gallbladder. I'll take 2 of those. Do behind the ear the young linking point, or the Kawai thyroid point under the tendon. And then what I'll do is I'll take the red and green clip of the Pachi, place it in the front of the ear, and spark the back and place the black cord on it. But that's usually I will wait. I'll wait a little bit. But you can certainly just use the eustachian tube point behind the ear, absolutely. And also just to suggest that, to say that sometimes because that treatment is not so comfortable, it's quite strong. I often just do 2 rings in the ear and cover with aluminum and spark that.
So that would be covering the whole ear?
The aluminum will cover the whole ear. But you fold it over. You don't have to tape it to the hair. So you have 1 ring at the top coming into, like, say, 0.0, 1 ring at the bottom that comes into 0.0. The red and green clip go on the 2 rings. There's a video of it. Yeah. And then I cover with aluminum, but the aluminum I fold it over the ear, so it's not like the whole head is covered with aluminum, and then spark.
Okay.
And connect the black clip to the aluminum foil. Okay. That's a lot gentler.
Yeah.
Now I will say that the eye treatment, speaking of these crazy, pachi treatments, the eye treatment where I put a chain in the ear, and spark that actually also, if you just use do 20 or maybe the chin point or something, that's actually a treatment that some people have said that it works for the ears also. Even it is meant to be an eye treatment. It's supposed to basically kind of like, I don't know what the right expression would be, but it's supposed to sort of like open up from the sides to open up the back of the eye. That's its purpose. But it can open the ear.
Sorry, Debbie. Sorry. Okay.
So yeah, that was it.
Okay, that's great. Thanks, Debbie. You're
welcome.
So you wouldn't do anything to address fluid, per se?
The problem with fluid, I mean, not the way this was described. In other words, I don't see any other fluids anywhere except supposedly, possibly in the eustachian tube, where one person's saying that there aren't any, because is it fluids? Is it what are they called, these stones or these hairs that can be misplaced in the ear? I mean, how do I know? Because it's not like, if you said she has edema, then I can say, yeah, okay, there's fluids. But this description, it's like, yeah, I hear that there's bubbling. And that certainly makes it, this is why I can see why the patient is saying, I'm convinced this expert doesn't know what they're talking about. It's fluid. I can hear the damn fluid, but what you hear and what is may not, we hear things that are not necessarily how shall I say it? People hear all sorts of things from God to all sorts of things that are not necessarily there, for other people at least. So it's a subjective sensation that makes you latch onto the fluid part. So I don't have that methodology of thinking that's saying, oh, it's dampness, or it's, I don't have that way of looking at it. If there was something else that said fluids, then I would say, okay, maybe, but that's, terribly common pattern, and, that people are looking for, of dampness, of fluid accumulations, of something like that. I don't have that. It's not so much in my repertoire. It's there, I know about it intellectually, but it's not a natural thing for me to apply.
Okay.
That make sense?
Is there anything else, Mary Jo, in this person's health history that wasn't mentioned? Any other illnesses?
Not really. She's quite young. She's like mid-20s. Some time ago, it was some time ago, it might be 2 years or something, I did previously treat her, and I do remember that she had the adrenal reflex, and she does kind of have sort of muscular things, and like tight IT band, and she complains of some issues like that when she's training. But the other major thing for her really was acne, as when she was younger, and she did take antibiotics for that. But no other major issues really.
Thank you.
So from what you've mentioned, well, the acne kind of depends, but the acne may suggest adrenal, may not, or hormonal. The other thing is, I would check the liver because of the antibiotics. And then finally, so you said she has a tight IT band, which is, part of the gallbladder channel. So it's part of this whole, remember before, I said, like the more primitive life forms, so to speak, primitive, don't have a neck. And, like I think they usually don't have ears. I'm not an expert on, zoological developments and stuff, but I think a lot of them have like fish have sonic something, on their sides. They hear, but not through like our type ear. They're, and it's lower. So that's the Shaoyang is the ear is definitely a Shaoyang component. So you can look at, for example, because there's another component on her Shaoyang that's tight. So you can look at gallbladder 22, maybe gallbladder 26, maybe even 31, maybe 34. But at that point, yes, it's worth looking at what can I extract out of the Shaoyang in that particular situation.
Yeah, she does have a tendency to turn her feet. I'm not too sure if it's both or one. When she walks, she kind of turns, and I was
turns out or turns in.
Turns in.
So it collapses the foot. She.
Yeah.
Okay.
Yeah.
Okay. That would suggest that there is some tightness in the liver 12 area. Because the leg is being pulled inwards. Although it can be something where the foot isn't held well, from say stomach 41. It's one has to sort of figure out where is the rotation coming from, the ankle, the knee, or the hip.
Yeah.
Because there are people who are the ligaments or joints are extremely flexible. If you asked me to do it, there's not a chance in hell. I can barely get the foot turned in if I do it from the hip. But there are people whose ankles will go their knee is facing straight, and at the ankle they're totally rotated. It's like, wow, how the hell did you do that? And some people's knees are very odd too. And even though it's not supposed to work that way, there are people whose knees will basically twist inwards or outwards. you know, which is, it sounds like she's some sort of athlete because you said something about she's training.
Yeah. Well, yes, she's quite active. You know, she runs and plays. It's camogie. It's our national kind of women's game here.
Mhm.
You know, hurls. She plays that, and football. You know, so she's quite active, and yeah, does yoga as well. But she often she complains about the the IT band a good bit.
Yeah. So what I would look at with the, possibly because of the IT band, there might be something in the sacrum that's shifted, which affects the shift in the neck, and therefore predisposes her to these ear problems. So that's another possibility of looking at stuff.
Okay.
You know, what can you extract out of the sacroiliac ligaments?
It's great, Abby. Thank you very much. Good notes.
Anyone else?
Can I ask, you know, you just kind of touched in passing that, you know, check liver because of antibiotic use.
Mm-hmm.
So I haven't seen this person, but I've got the somebody who I may see a bit later. She had a lot of antibiotics use, and the current condition that she's most worried is digestive issue. Obviously, you would expect that, and diarrhea, not to the extent she calls it diarrhea, but you know, she goes to the toilet many times and it's loose, and sometimes, you know, bad smell and whatever. But where would you expect to see the reflex point? You know, because you said you check liver, so it's just under the rib cage. Would you check?
Yeah, under the rib cage as well as liver 14, it's proper. But also, so people who I'm suspecting that, okay, many people with liver issues don't show it on the front, but they will show it on the back. Okay, it's not that uncommon. It's kind of annoying.
Mm-hmm.
So they'll show right side T7 to T9, either on the Wattos or on the bladder line, the inner bladder line, but they don't seem to show the liver on the front. I think it has to do with maybe the way the rib cage is and what presses, what does, you know, whatever, what adjusts, what doesn't adjust. I'm not sure, but it is fairly common. You know, you're going, I'm sure this person is liver, but they're not showing it on the front. The other thing is, sorry, I just lost my train of thought. With digestive issues, that when it's liver, it actually may show, strangely enough, it would show on the left upper quadrant. Okay. So, look, think of left stomach 23 or 22, something like that, you know. And this is the reason why, because the liver's on the right side, so you don't expect it to show there. So I'm not talking about under the ribs, you know, it's more medial, and it's more, you know, on the abdomen itself, and maybe somewhat lower as well. It's above the navel though. The reason why is because, so from the liver, if the liver is affected, it's affecting basically through common bile duct. And it's going to affect the first section of the small intestine, which is primarily on the left side. Okay, so let's see, duodenum, jejunum, ileum. Okay, so I have to figure out who's who and all of this. So your duodenum is relatively short, and it's not a big absorption phenomenon. It's more like sort of a place where things just get messed up. You know, you get all the chyme, you get the pancreatic enzymes, you get the bile, and then it moves over. So the common bile duct is on the right side at, say, around level of stomach 22. Okay, your duodenum is now taking all that mess, okay, and shifting it towards the jejunum, you know, which is basically more moving from the left side towards the navel. And there's a big concentration on the navel, and then it, quote unquote, changes into the ileum, which is around the navel. Remember, it all spirals in. You know, it's not like the large intestine that's sort of lineal up, across, and down. The small intestine is is twisting around all the time. So it's not like it's moving in one direction, but in spirals. Okay. So the jejunum ultimately is going to end up on the right side. Say what we claim stomach 26, 27, the ileocecal valve. Okay. So the part that's on the left is much more greatly affected by the liver, even though it's on the left, because it's actually the closest portion to the liver in the digestive system. Okay. Now, separately from the stomach, we're now talking about the small intestine specifically. So having done all this explanation, I've lost a little bit track of the question. So this person has, if it's antibiotics and had it affected the liver, and now they're showing digestive issues. So yeah, there's a possibility that liver is involved, and I would check it either under the ribs here, but also because that may not show, and it may still be liver, I would check, do they have anything on the left side around stomach 22, 23? And does a liver treatment release that? And then I have some sort of positive answer, yes or no. But in fairness, lots of antibiotics, the first thing you're going to look at is the intestine, and especially since you're saying it's primarily an issue of more like, diarrhea more than just absorption. In other words, you didn't say this person's complaining of huge fatigue, blah, 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 blah. So that's, I would look at more the antibiotics and possibly the flora, problems that might have gotten created from it. And as an extension of that, and which connects you back to liver, unfortunately, also, there is some possibility of parasitic infections, worms, etc. So I know what the Westerners don't like to, we just assume that we don't have any of that, but we do. We just don't have things that are seen. We just don't have large crawly things that come out. They're just microscopic, and all these things love the liver. So I mean, with children, like with tapeworm and stuff, you see it through the stool, but actually the truth is that the worms are not living in the worms are going to the intestine in order to go out and lay eggs outside, but they're actually more interested in your other organs, and the liver is one of them. So so just to suggest there is some possibility of that sometimes also. And that's not always that easy to check. And quite I don't have great acupuncture points for worms and stuff like that. No, I certainly in ancient books, they love that stuff. It's big in the literature. But where you can just try different, like the different modalities that you have for parasites, whether it's coconut, papaya seeds, pumpkin seeds, have some effect. It's supposed to be more paralytic than actual killing parasites, but coconut, papaya seeds, and then you have the things that you actually need to get in formulations, because you can't get it, like it's not like food. Carrots. Some people, carrots, high dosage of carrots and high dosage of garlic can help. And then you have your black walnut, your wormwood, cloves. Cloves you can eat, but it's quite. If you do a lot of cloves, you're going to feel very bloated and gassy. So, sometimes it's not, it's very, very spicy. So sometimes it's easier to take it in some sort of pill form. But, so those are things that come to mind for me.
Okay. Thank you.
You're welcome. Anything else?
I heard, Evie, that actually treatment for those worms, parasites that they've discovered in Africa, that actually they have you know, it's a good treatment for COVID patients. I don't know how true that is, but
you mean the veterinarian, the heartworm medication?
I'm not sure what
or something.
I'm not too sure what medication, but I know it's the medication that used to be given to people, you know, that had worms in the intestine. You've heard that?
Yeah. I'm not sure what the name is. It's something isonavir or something. It's well, because we don't see it a lot for people, but it's used for dogs for heartworm.
And I think because of the you know, the water being very impure in parts of Africa, that they give them this as well, this dose, whatever it is.
Right, so they automatically get it, and then they're saying, because there is this big question, how come most of Africa is not, we thought that Africa would be like this hotbed of COVID,
you know,
because conditions, etc., and suddenly it isn't. So people, although South Africa certainly is a hotbed, but so, you know, I don't know, maybe they don't put this these dewormer things in South Africa. So, wow, this is so, no, I mean, it's a very interesting phenomenon because it's been for a number of years now. You know, if you look at like Chinese herbs that are used for different things that are not quite part of their usage, you see that anti-malaria drugs, for example, seem to work for various other infections. You know, and this is like, for example, why Artemisia Qinghao is very popular. And there's a number of those kind of things where, you know, the things that originally were used for parasites seem to be effective for, you know, some of these mysterious diseases. And that's where you have someone like Heiner Furhoff, or I don't know how to pronounce his last name. German is not my, I don't know German enough to, but you know who I mean. And who's quite a interesting, you know, he's quite well versed, and you know, he's you know, I mean, he's not someone who just, you know, kind of makes shit up. You know, he's not a conspiracy theory acupuncturist sort of out in the fringe or anything. He's like, one of his big things is this whole, so to speak, goo syndrome. You know, these sticky things that you can say are parasitical, or you can just say that they're sticky. And, you know, and he has a company, etc., and he has like a whole bunch of formulas for that stuff. And some people say that his stuff is very good for treating COVID. So I don't have the personal experience with this, so I can't say. But there's definitely been a huge, and before COVID already, because Heiner is a fairly popular person in the field and very well known. So I would say the past, and by the way, because of the Lyme disease issues, Lyme is a difficult disease to treat, and he looks at it as goo syndrome, you know, sticky, staying around, parasitical, you know, kind of phenomenon, which, yeah, if you know, when you're looking at a tick, you know, so it makes sense. So, you know, there's been a very big movement within the acupuncture world to, as opposed to like when I went to school, you know, 30 years ago, and people, you know, that there were herbs for worms and whatever, and we're, you know, kind of like, well, yeah, I'll never treat anybody with these herbs or whatever. Now there's a very strong coming to that, although they're sometimes different, you know, different herbs, you know, than we had originally thought. So yeah, I think part of it is that when you're looking at, okay, if you're looking at a bacteria for the most part, you know, they're relatively, because they're tiny. I mean, you know, so for example, you know, you can drown a lot of things with soap and water. Now, you can do it internally, granted, but you can do so. You know, you cannot wash a worm away with soap and water. I mean, you can deter it, but, you know, it's a larger organism. It requires more poison is basically the issue. You require some bigger guns and much more on the one hand, more subtle treatment, on the other hand, like stronger treatment for worms. So therefore, when you're getting into like more complex diseases that are stickier, of course they're going to look much more like worms and parasites. Whether they are or not, I don't know. I'm not passing a judgment, but that's how I'm thinking. How come in the last 10 years, or however long it's been, besides Heiner, okay, fine, why is it that we keep looking? And there's been, like, also in the Western front, in Western medicine, there's been antimalarial drugs that seem to work for other disorders. So I'm just thinking, how come? And I think partially because it's all about the stickiness of the conditions. Conditions that stick around get bigger guns in the treatments, and therefore they're going to work for other conditions as well, as opposed to if you take, an herb like, say, Isatis, which is like the quintessential antiviral, antibacterial. Okay, well, I mean, I know there's others, but let's just call it the quintessential. It may not be as effective for some of these longer, stickier things like Lyme, etc. We don't talk so much about Isatis for Lyme. So that's just my thinking, but I honestly, I don't know enough about it. So I'm just shooting off my mouth. Sorry. Anyone else before we end?
Can I just quickly ask, do you use, I think Kiko mentioned about 6 flowers treatment, was it for digestive issue, T7, T9, T11, T12? When would you be using that?
Oh, okay. No, it's a very fair question. So that's a standard sort of one of those Japanese combinations, that's out in the Japanese textbooks, apparently. Mm-hmm. It's supposed to be a moxa combination. It's supposed to be the bladder points, bladder 17, bladder 18, bladder 20 is like I think the official version. And when I would use it is basically when I've done everything else and I'm not sure what else to do, I'll say, hey, what the hell? No, it's like I'm going, digestive issue. It's just like, look, it's natural. It's just like, look, if I'm a TCM practitioner, somebody comes with digestive issue, what do? Stomach 36. It's like it's in the fucking text. Excuse my language. It's in the text. You do it. So while I can't, so it's not like I can say 6 flowers does a great job if they have this kind of pulse or that reflex, or if their tailbone is shifted and they have digestive issues, 6 flowers is the remedy. I don't have that. What I do is I'm saying at the end, when I've done everything I can and they're already face down, I will consider adding all 6 or some of them or whatever, more like that. Mm-hmm. Than that, or than a clarity of it resolves X, Y, and Z. Mm-hmm. Does that make sense?
Yeah, I just thought it was interesting because it has got a T7, T9, so obviously liver and ANS, and then T11, T12, so sugar point. So I thought, well, digestive enough, yeah.
Yeah, no, and it is digestive. It is digestive enough. So you basically you can say T7. It's your diaphragm, but you can also say it's your pancreas or the common bile duct area. Okay. Now to that, I would actually add T5, except I would add T5 at the Watteaus, because T5 and the stomach are related. Okay, so if there's a stomach problem, as in nausea or things like that, that's where T5 comes in. But yeah, so T7 is the opening of the beginning of the digestion beyond the stomach, that is. And then the liver affecting digestion, and then the spleen. I mean, from a TCM perspective, it's like, it's very clear. And some people say T6 is pancreas shoot. So it really does, and I think that's how the combination actually originated, based on that theoretical model.
Okay, thank you.
would be my assumption. I wasn't around when they made up the, when they wrote up these texts. It wasn't like they consulted me. All right. Patrick, do you have anything to say before we end?
No, thank you.
No problem.
I'm just glad to be there.
Okay. We're glad you're here. All right. So enjoy your week. And
You too.
I'll see you next week.
All right,
Bye.
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 Thank you so much, Avi. Goodbye.
Yes, thank you
welcome.
very much.
Bye.
Thank you.